Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This week we cover major developments and events from October 10 through 16, 2025, across the Middle East's healthcare, public health, life sciences, and wellness landscape. These areas are vital not only for the region's populations, but also for governments, hospitals, research institutions, pharma and biotech firms, and wellness organizations. In this report we'll walk through key sections, from policy and research to hospitals and population health, bringing you detailed, country-specific updates and analysis. Our sources include official health ministry releases, news agencies, WHO, UN updates, and NGO reports, all carefully cited below. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. The week of October 10 to 16, 2025 showcased a dynamic regional health landscape defined by ambitious reforms, innovative scientific strides, and persistent on-the-ground challenges. Governments accelerated health policy initiatives, from forging international partnerships to expanding care infrastructure, underscoring a commitment to stronger, more accessible systems. At the same time, Middle Eastern researchers and institutions pushed the envelope in life sciences and digital health, signaling the region's growing contributions to global medical innovation. Yet, these advances unfolded against a backdrop of enduring difficulties. Conflicts and humanitarian crises continued to strain health services in areas like Gaza, Syria, and Yemen, while environmental and economic pressures tested systems in countries such as Lebanon. First, we have healthcare policy and government initiatives. Governments across the Middle East drove significant health policy moves during this week. In Egypt, the health ministry pursued international collaboration to bolster specialized medical services. Minister Dr. Khalid Al-Ghaf met with representatives of China's Ningbo Clinical Pathology Diagnostics Center to explore partnerships in digital diagnostics and artificial intelligence, part of Egypt's efforts to modernize its healthcare system. The talks, held on the sidelines of a Shanghai tech conference, focused on launching online training for Egyptian lab technicians in advanced pathology techniques and AI applications. They also discussed staff exchanges, joint research in oncology and genetics, and setting up a digital consultation platform for complex cases. By integrating global expertise in areas like telepathology and precision diagnostics, Egypt is aligning policy with innovation to strengthen its health sector. In the United Arab Emirates, a recent leadership change set the stage for policy renewal in healthcare. A cabinet reshuffle in September saw Ahmed Al-Saeed appointed as the UAE's new Minister of Health and Prevention. This week, the ministry's agenda under his watch continued emphasizing preventive care and technology adoption. Health authorities highlighted ongoing initiatives to improve care quality and access, consistent with national strategies like the UAE National Agenda and Vision 2071. Notably, the UAE is expanding public health protections in schools, more on that later, and integrating advanced digital health tools across facilities. These policy directions show continuity with the country's prior investments in innovation and wellness, now reinforced by fresh leadership at the helm. Regional cooperation remained a theme in health diplomacy. Officials from Gulf Cooperation Council countries built on recent meetings aimed at GCC health integration. Earlier this month, Saudi Arabia's health minister joined GCC counterparts in Kuwait to advance collective initiatives. While that gathering fell just before our date range, its impact carried into this week as Gulf ministers began acting on decisions to standardize healthcare regulations and share resources. They agreed to develop healthy cities across the GCC and to unify the registration of health professionals, streamlining cross-border practice. A new Health Innovation and Excellence Award was launched to encourage adoption of cutting-edge technologies like artificial intelligence in healthcare. Saudi officials noted these steps reinforce the GCC's regional and global health presence and expand partnerships with international organizations. Such high-level policy coordination reflects a broader commitment by Gulf governments to integrate their health systems for greater efficiency and impact. Beyond the Gulf, other countries also focused on governance and reform. Jordan and Yemen continue to implement a medical cooperation agreement that allows Yemeni patients to receive treatment in Jordanian hospitals and Yemeni doctors to train in Jordan, an initiative first reached earlier this year to help rebuild Yemen's health capacity. This week brought progress updates. Jordan's Ministry of Health reported that new groups of Yemeni resident doctors have begun their hospital rotations in Oman and Erbil, bolstering critical specialties in Yemen upon their return. This kind of policy, using regional partnerships to fill healthcare gaps in conflict-affected states, underlines how Middle Eastern governments are leveraging diplomacy to improve health outcomes. Meanwhile, at a high-level WHO meeting on October 15, Middle East health ministers collectively emphasized the link between peace and health. The WHO's Eastern Mediterranean Regional Committee convened in Cairo, where officials from across the region discussed strategies for rebuilding health systems in countries stricken by war and crisis. Echoing the WHO Director General, delegates reiterated that there is no health without peace, and no peace without health, a recognition that policy efforts in healthcare often depend on stability. They endorsed resolutions calling for strengthened emergency preparedness, sustained support for countries like Syria, Sudan, and Palestine, and accelerating progress toward universal health coverage. The meeting's outcomes signal continued government-level commitment to collaborative policy solutions for the region's toughest health challenges. Across the Middle East, these policy and governance initiatives share a common theme, leveraging reform and partnership to build more resilient health systems. From Egypt's international tech alliances to the GCC's integration plans and humanitarian health diplomacy, governments are actively addressing structural issues through strategic planning. While approaches differ by country reflecting varied economic conditions and health system maturity, the week's developments demonstrate a collective resolve that effective policy leadership is essential to improving health outcomes. Next is life sciences and research innovation. The Middle East's research and innovation engine was in motion during this period, with several countries achieving milestones in life sciences. In the United Arab Emirates, a notable scientific breakthrough emerged from the labs of NYU Abu Dhabi. Researchers at NYUAD announced a new type of brain implant enabling ultra-precise multi-site drug delivery in the brain. The device, called Spiral, Strategic Precision Infusion for Regional Administration of Liquid, is a thin, flexible probe that can release medications at several specific points inside brain tissue. This allows doctors to target larger or multiple regions simultaneously while minimizing invasiveness. According to lead bioengineer Khalil Ramadi, current implants deliver drugs from only one or two sites, but Spiral's helical design with carefully spaced outlets permits even distribution across a wide area without added risk. Early studies published in the Journal of Neural Engineering showed the implant did not trigger more inflammation than standard single-point implants, indicating it could be used safely for long-term treatments. This breakthrough opens exciting possibilities for treating neurological disorders like glioblastoma, epilepsy, and Parkinson's, conditions where delivering drugs past the blood-brain barrier to multiple targets is key. The Spiral project exemplifies how Gulf-based research institutions are contributing cutting-edge medical innovations with global relevance. The UAE also demonstrated its prowess in genomic medicine this week. Abu Dhabi's Department of Health reported that over 800,000 DNA samples have been collected so far under the Emirati Genome Program, one of the world's largest national genomics initiatives. Speaking at the GITEX Global Tech Forum in Dubai, officials highlighted that the Genome Program is focused not only on research, but on preserving wellness and extending the longevity of future generations. By mapping the genetic makeup of Emirati citizens at scale, the project aims to enable personalized, preventive healthcare tailored to the population's unique risk factors. We are moving beyond a one-size-fits-all model toward proactive, personalized care, said a senior health strategist, noting that this data will inform new therapies and early interventions. The Emirati Genome Program, now well past the 750,000 samples mark, reinforces the UAE's position as a regional hub for life sciences and health innovation, and its results are expected to yield insights benefiting not just the UAE but global medical knowledge. Elsewhere in the region, Qatar continued to cultivate its biomedical research ecosystem. Although the week's main events in Qatar were forthcoming conferences, such as a late October Doha Summit on Climate and Health, the nation's ongoing programs in precision medicine bore fruit. Qatar's Syria medicine and research institutions built on momentum from earlier in the year, where they had launched initiatives like genome-based newborn screening and pediatric disease modeling conferences. This week, researchers reported progress on implementing polygenic risk scores, a cutting-edge approach to predicting disease risk from multiple gene variants in clinical settings as part of Qatar's precision medicine efforts. Such advances are positioning Qatar at the forefront of applying genomics to everyday healthcare, complementing the UAE's strides in this domain. In Egypt, research innovation is being spurred through international partnerships and knowledge exchange. The collaboration between Egypt's health ministry and China's Ningbo Pathology Center, noted earlier as a policy initiative, also has a strong R&D component. Under the agreement being discussed, Egyptian and Chinese experts would undertake joint research in areas like oncology, molecular genetics, and AI-driven diagnostics. By working together on studies, for example, sharing data on cancer biomarkers or co-developing AI algorithms for pathology, Egypt hopes to accelerate its scientific output. The Health Ministry noted that this partnership builds on previous collaborations, such as those with US hospitals on children's cancer and with UK institutions on genomics, to integrate global scientific expertise with local research priorities. The outcome could be new publications, improved lab techniques, and ultimately, enhanced diagnostic services in Egypt's health system. Meanwhile, Jordan garnered regional recognition for medical research this month. At the American College of Cardiology's Middle East Conference, held in early October in Dubai, a Jordanian cardiology researcher won a top award for a study on cholesterol levels and cardiovascular risk factors in Middle Eastern patients. Alongside peers from Egypt and Turkey, Jordan's young scientist will present his work at the ACC's 2026 Global Meeting, a sign that local investigators are contributing to advances in heart health. These successes reflect how even countries without vast research infrastructure are fostering talent and producing findings relevant to regional health challenges. Biotech and pharmaceutical developments are next. The biotech and pharmaceutical industry saw robust activity, with Middle Eastern nations balancing domestic needs and global aspirations. Saudi Arabia made headlines by gearing up for a new wave of biotech and pharma partnerships. The kingdom is set to unveil major agreements with international companies at the upcoming Global Health Exhibition 2025 in Riyadh later this month. According to Saudi officials, these deals will span vaccines, biotechnologies, pharmaceutical manufacturing, and digital health solutions, all aligned with Saudi Arabia's Vision 2030 goals of improving healthcare quality and localizing industry. Saudi Arabia's healthcare market is projected to grow from SAR 199 billion in 2020 to SAR 318 billion by 2030, with the private sector's contribution doubling to SAR 145 billion. To attract investment, the government has been creating a more competitive environment, streamlining regulations, and offering support in high-priority fields like vaccine production, health tourism, and medical AI. Last year's Global Health Exhibition generated over SAR 50 billion, $13.3 billion, in health sector investments, including a $1 billion drug manufacturing partnership and several multi-billion rial hospital deals. This year, the expectation is to build on that momentum with new partnerships that further boost Saudi self-sufficiency in pharmaceuticals and cement its status as a regional biotech hub. The anticipation around these announcements underscores how Saudi policy is marrying economic development with health sector growth. In Egypt, momentum continued on its ambitious pharmaceutical industry expansion. Following the government's strategy to transform Egypt into a regional medicine manufacturing hub, targeting $5 billion in medical exports by 2030, this week saw concrete progress. Egypt's state-owned vaccine producer Vaxira disclosed that its new joint venture vaccine factory, built in partnership with a Chinese firm, is nearing completion in 6th of October City. When operational, it will produce COVID-19 and influenza vaccines for domestic use and export to African markets. Meanwhile, the Health Ministry's high-profile Committee on Pharmaceutical Exports, formed in August, reported early achievements such as fast-tracking the registration of Egyptian generic drugs abroad and negotiating regulatory alignment with target countries in Africa. Embassies have been actively promoting Egyptian pharmaceuticals and even health tourism opportunities. These developments indicate that Egypt is steadily implementing its plan to become a pharma manufacturing powerhouse, leveraging diplomacy and industry coordination to boost exports. The Gulf states continue to invest heavily in biotech and medtech ventures. In the United Arab Emirates, Abu Dhabi's recently launched initiatives in biopharma and health tech maintained their momentum. Earlier this year, Abu Dhabi announced the creation of a large biopharma hub and investment incentives to attract biotech companies. This week, local media reported that new partnerships seeded at that launch have progressed to execution, for example, a deal with an international biotech firm to establish an R&D center in Abu Dhabi, and a memorandum of understanding to build a manufacturing plant for advanced therapies in the UAE. These moves complement the UAE's progressive regulatory framework and robust research infrastructure, underscoring how the Emirates are capitalizing on their innovation-friendly policies to foster a vibrant biotech ecosystem. Dubai, for its part, hosted GITEX Global 2025, where Day 3 spotlighted digital health and biotech innovation, with hundreds of startups showcasing health tech solutions from AI-driven diagnostics to biotech research tools. The energy at these events reflects a region confident in blending technology with life sciences to spur new industries. Another significant trend is the region's focus on medicine pricing and affordability. About 6 weeks after Qatar enacted sweeping medicine price cuts, reducing over 1,000 drug prices by 15 to 75%, patients are beginning to see the benefits at pharmacies. By mid-October, many essential chronic disease medications in Qatar now cost a fraction of their summer prices, easing out-of-pocket burdens for people with diabetes, heart conditions, or cancer. Qatar's policy could ripple beyond its borders. Regional pharma companies are adapting their strategies, and neighboring countries are watching closely to see if lower prices lead to any shortages or if they stimulate a shift toward generics. This week, health economists in the GCC discussed Qatar's model at a conference, suggesting that a coordinated Gulf approach to price regulation might emerge to tackle the rising costs of drugs. In contrast, Iran continued to struggle with surging medicine prices due to its economic turmoil. The Iranian rial's plunge has driven up import costs. As reported previously, some specialized drugs have quadrupled in price, and shortages remain severe. Iran's predicament, highlighted by state media warnings of imminent spikes in medicine and equipment costs, serves as a cautionary tale of how macroeconomic instability can imperil pharmaceutical supply. The Gulf states' robust investments and Qatar's proactive price management stand in stark relief to Iran's crisis, illustrating how sound economic management and engagement with global trade are integral to ensuring a stable pharmaceutical supply. Now, we turn to public health challenges and disease outbreaks, always a critical discussion. Persistent public health challenges were evident across several Middle Eastern countries, often exacerbated by conflict, infrastructure deficiencies, or environmental hazards. In the Gaza Strip, a humanitarian health crisis continued even amid a tentative lull in fighting. On October 9, a ceasefire was announced between Israeli forces and Gaza factions, bringing a brief respite in hostilities. This week, under the truce's terms, Israel returned the bodies of dozens of Palestinians to Gaza, including 30 bodies handed over on October 16, allowing families to bury their dead after long waits. While this was a humanitarian gesture, Gaza's health system remains in dire condition. Hospitals, which suffered damage in earlier strikes, struggle to care for thousands of injured with scarce supplies. Aid organizations warn that, even with fighting paused, the Strip faces the fallout of prior violence, high numbers of trauma cases, mental health crises, and the looming risk of disease outbreaks in crowded shelters. International NGOs scrambled this week to bring in critical supplies during the ceasefire, but officials noted that fuel for hospital generators and clean water for sanitation are still dangerously low. Gaza's plight starkly illustrates how conflict creates cascading public health emergencies, from direct casualties to breakdowns in basic services. As one health worker put it, even peace needs help to heal, underscoring calls for sustained humanitarian access to rebuild Gaza's health capacity. In Syria, the public health impacts of the protracted conflict remain profound, even as active combat has lessened compared to earlier years. This week, Syrian health authorities launched a nationwide vaccination campaign to curb a growing measles outbreak, one of the aftermaths of disrupted immunization during the war. Beginning October 12, the Ministry of Health, with support from WHO and UNICEF, set up nearly 1,200 vaccination sites and deployed over 1,000 mobile teams across Syria to immunize children against measles and other preventable diseases. The campaign is part of the global Big Catch-Up initiative, aiming to reach millions of Syrian children who missed routine vaccines during years of instability and the COVID-19 pandemic. In cities like Aleppo and Homs, parents lined up with their kids at clinics and mobile units, hopeful to protect them from illnesses resurging in the conflict's wake. The effort highlights a race against time. Syria has witnessed sporadic cholera and polio cases re-emerge in recent years due to low immunization coverage and damaged water systems. As of mid-2025, 16.7 million Syrians need humanitarian health assistance, and overcrowded displacement camps with poor sanitation continue to breed diseases. The renewed vaccination push, alongside deliveries of cold chain equipment like refrigerated trucks to transport vaccines nationwide, is a critical step to prevent further outbreaks. However, WHO officials stressed this week that without sustained peace and reconstruction of health infrastructure, such gains remain fragile. Beyond acute crises, the region's high burden of non-communicable diseases, NCDs, remains a silent but critical challenge. This week, new data from the International Diabetes Federation spurred conversations in Gulf countries about the diabetes time bomb facing their populations. Rates of diabetes and obesity in the GCC are among the highest globally, with roughly 1 in 5 adults diabetic in some Gulf states. Health ministries in Bahrain and Kuwait used the occasion of World Obesity Day, October 11, to highlight ongoing initiatives. Bahrain reported progress in its national diabetes registry and lifestyle modification programs, while Kuwait's public health campaign to improve school nutrition, such as banning sugary drinks and junk food in canteens, initiated in August, has entered its implementation phase. Kuwait this week showcased early feedback from schools. Many reported increased demand for fruits and healthier snacks as awareness grows. These efforts to combat NCDs are crucial as chronic conditions continue straining regional health systems. For instance, Lebanon, in the throes of economic collapse, is seeing worsened outcomes for chronic patients. Over 70% of Lebanon's population now relies on the Ministry of Health for medications as private insurance erodes. However, medicine shortages and skyrocketing out-of-pocket costs, with patients paying 85% of health expenses themselves, mean many are foregoing treatment. Lebanese hospitals, once among the region's best, are losing staff to emigration and struggling to keep equipment running amid power cuts. This week brought reports of cancer drug stockouts in Beirut and dialysis centers cutting back services due to lack of supplies. Lebanon exemplifies how economic instability translates into public health regression, with NCD management severely compromised. Overall, the region's public health challenges this week highlight a sobering reality. Gains in health and wellness can be rapidly undermined by conflict, economic instability, and environmental neglect. Whether it's securing ceasefires to protect hospitals, shutting down a polluting factory to prevent cancers, or shoring up collapsing health systems in Lebanon and Yemen, a concerted effort is needed to address these vulnerabilities. International support and strong local governance remain vital. Without such measures, the progress seen in other spheres of Middle Eastern health development could be offset by these enduring challenges. Yet amidst the difficulties, there are rays of hope, like Syria's nationwide immunization drive or community activism in Tunisia, indicating that people and governments are not passive. They are striving to reclaim the basic health protections on which stable, prosperous societies depend. Next, we'll look at wellness and health promotion efforts making positive impacts. Health and wellness promotion efforts maintain momentum across the Middle East, emphasizing prevention, healthy lifestyles, and community well-being. This week featured several initiatives targeting public awareness and preventive care, often tied to global health observances in October. Foremost, October is Breast Cancer Awareness Month, and countries across the region participated vigorously in Pink October campaigns. In the United Arab Emirates, an unprecedented nationwide effort is offering free breast cancer screenings and education throughout the month. The Sharjah-based NGO Friends of Cancer Patients, FOCP, launched its flagship Pink October UAE program, mobilizing over 86 clinics and screening sites across all 7 emirates. From October 1 to 31, women and men can access free clinical breast exams, mammograms, and ultrasound tests at these sites, which include both fixed locations, malls, healthcare centers, and mobile clinics traveling to underserved areas. The Pink Caravan mobile units have been visiting workplaces, universities, and community events, effectively bringing early detection services to people's doorsteps. To drive home the message, FOCP and partners organized family-friendly happenings such as a 3-day wellness festival in Sharjah's Al Jada Community Park with screenings and fitness activities, and a Battle Cancer Challenge event in Dubai combining a charity obstacle course with on-site exams. Companies have been invited to host on-site screening days, with corporate wellness packages that include mammogram vouchers and breast self-exam workshops, as part of a push to involve the private sector in public health. Pink October reflects our vision of a health-conscious society that values prevention and early action, said FOCP Director Aisha Al-Mullah. The strong turnout so far, thousands have been screened in the first half of the month, shows growing public engagement. UAE health leaders noted that such community-driven campaigns not only catch cancers earlier, improving survival rates, but also help destigmatize screening and empower people to take charge of their health. Similar breast cancer awareness drives rolled out in Bahrain, Qatar, Oman, and Saudi Arabia, underscoring a regional unity around the cause of women's health this month. October 10th was World Mental Health Day, and it too resonated in the Middle East with a variety of outreach efforts. This year's WHO theme focused on the mental health needs of people in humanitarian emergencies, highly pertinent for this region. In Jordan, for instance, the Ministry of Health collaborated with NGOs to host a public symposium addressing trauma and resilience among refugees and conflict-affected communities. Syrian refugees in Jordan shared testimonies of coping with displacement stress, while experts discussed expanding community-based psychosocial support. Across the Gulf, a more light-hearted awareness approach was seen. The UAE-based gym chain, Gym Nation, literally removed all weights from select gyms for a day to symbolize lifting the weight of mental burden, sparking conversations among gym-goers about mental fitness. In Saudi Arabia and the UAE, social media campaigns encouraged people to share positive affirmations and seek help when needed, using hashtags in Arabic that translate to #support not stigma. Health authorities in the UAE highlighted new resources like a 24/7 toll-free mental health support line and ongoing integration of mental health into primary healthcare. The emphasis on safe and toxic-free workplaces also featured in the Middle East's observance, with business leaders penning op-eds about reducing workplace stress and fostering employee well-being. These varied activities around World Mental Health Day indicate a growing recognition in the region that mental wellness is a key component of overall health, deserving of open dialogue and investment. The Middle East also saw wellness promotion through physical fitness and lifestyle initiatives. In Jordan, an innovative approach to addiction rehabilitation is incorporating exercise, a trend continuing from previous weeks. The new Fitness and Wellness Center at the National Addiction Treatment Center in Oman, which opened in late August, reported encouraging early results. This week, officials noted improved mood and physical health among patients engaging in regular gym sessions and sports as part of their recovery. The idea that a healthy body aids a healthy mind is gaining traction, with Jordan's pilot program potentially becoming a model for the region's substance abuse treatment by adding a wellness dimension. Saudi Arabia leveraged technology to promote wellness on a mass scale. The Health Ministry announced that its Sehati app, which was used to coordinate blood donations in a campaign this summer, helped achieve a record turnout in blood donors in 2025, contributing to self-sufficiency in blood supplies. This week, the app was updated with new features for chronic disease patients to log their exercise and diet, effectively turning it into a holistic health and wellness platform, not just for clinical appointments. The ministry is encouraging citizens to use it to track steps, get nutritional tips, and join health challenges, aligning with Saudi Vision 2030's goal of increasing the population's physical activity levels. Such digital engagement tools exemplify how Gulf countries are merging wellness promotion with their tech-savvy, youthful demographics. In the UAE, October also coincides with continuing efforts to combat the extreme heat that affects outdoor workers' health. Though summer has passed its peak, the UAE's Heat Safety Campaign, run by the Ministry of Human Resources and Emirati Ministry of Health, remained active in early October, offering refreshment stations and health checkups for construction laborers as temperatures only slowly begin to drop. The campaign, which provided thousands of workers with hydration packs and educational sessions on recognizing heat stroke, has been credited with a significant reduction in heat-related illnesses compared to previous years. It reflects the region's adaptation to climate-related wellness challenges through prevention and community outreach. Crucially, many wellness initiatives target youth and schools, embedding healthy habits early. For example, as mentioned earlier, Kuwait and UAE authorities are focusing on healthier school environments, from Kuwait's new canteen nutrition rules to the UAE's comprehensive school health programs. These efforts are part of a broader trend of health promotion in educational settings. Indeed, health and education sectors are collaborating more than ever. This week in the UAE, school clinics under Emirates Health Services wrapped up a back-to-school health drive that included workshops for students on hand hygiene and nutrition, and free vision and dental checks for first graders. By reinforcing healthy behaviors and providing preventative services in schools, Middle Eastern countries aim to curb future disease burdens and nurture a wellness-aware generation. Public health and wellness promotion efforts like these add to the narrative of progress amid the region's challenges. From Jordan's fitness-based therapy and Saudi's successful blood donation mobilization, to the UAE's multifaceted Pink October and mental health campaigns, there is distinct momentum toward preventive care and healthy living. These community-driven and often tech-enabled initiatives are vital in addressing the Middle East's high rates of lifestyle-related conditions, diabetes, hypertension, etc., and in cultivating a culture of wellness that complements clinical care. They show that improving health isn't just about hospitals and medicine, it's also about empowering individuals and communities with knowledge, resources, and motivation to lead healthier lives. Now we'll shift focus to digital health innovation, where the region is rapidly advancing in healthcare technology and e-health. Digital health and e-health innovation continue to transform Middle Eastern healthcare this week, with countries implementing new technologies from telemedicine to AI to enhance care delivery. Several developments highlighted the region's commitment to leveraging digital solutions for efficiency and reach. One of the week's spotlight events was GITEX Global 2025 in Dubai, one of the world's largest technology exhibitions, which featured an entire track on digital health and biotech. By day 3 of GITEX, October 15, digital health had taken center stage. Over 200 health tech startups and numerous global tech giants showcased innovations aimed at healthcare. Themes included artificial intelligence in diagnostics, blockchain for medical record security, VR, AR for medical training, and smart wearable devices for remote patient monitoring. Attendees from across the Middle East explored solutions such as AI algorithms that can detect diseases from imaging scans, virtual telemedicine platforms with augmented reality for remote physical exams, and hospital robots for supply delivery. The convergence of healthcare and cutting-edge tech at GITEX underscored how Middle Eastern countries are enthusiastic adopters of digital health trends, not just consuming technology but actively co-developing and customizing it for local needs. A concrete example of this was Egypt's presence at GITEX, where it pushed forward a national digital transformation agenda for health. Egypt's Deputy Minister of Health, Dr. Mohamed El Tayeb, held a high-profile meeting with executives from Epson on the sidelines of the expo to advance healthcare digitization in Egypt. The discussion centered on equipping Egypt's public hospitals with modern IT and imaging hardware, from energy-efficient printers and high-speed scanners to point-of-sale systems for hospital billing, as part of upgrading the ministry's infrastructure. Epson provided live demonstrations of their latest healthcare-grade devices, and Egyptian officials highlighted how these tools would streamline administrative workflows and patient record management. Dr. El Tayeb praised Epson's eco-friendly tech as aligning with Egypt's goals to enhance service quality while reducing energy consumption. The two sides explored concrete steps, launching pilot programs to integrate Epson systems into hospital operations, establishing dedicated technical support teams, and potentially rolling out electronic point-of-sale (POS) systems in hospital pharmacies to better track inventory and reduce wait times. This initiative illustrates how Egypt is embracing digital health infrastructure improvements, moving from paper and legacy systems to integrated, efficient digital ones. It's effectively a government-private sector partnership that will support Egypt's broader push for e-health, including its ongoing project to implement a universal electronic health record system. In the GCC, existing digital health platforms expanded their capabilities. Saudi Arabia's Seha Virtual Hospital, SVH, the region's largest telemedicine network connecting over 130 hospitals, reached new milestones in utilization. This week, SVH Doctors performed the platform's 10,000th remote consultation since its launch, treating patients in remote areas who otherwise lacked access to specialists. Saudi officials also announced plans to integrate the SVH system with the country's electronic health record network by year's end, allowing seamless sharing of patient data between the virtual hospital and physical facilities. The Seha Virtual Hospital is already considered the world's largest virtual hospital, and it continues to grow, offering services from radiology reads to psychiatric counseling via digital channels. Its success is paving the way for other countries. Bahrain and the UAE have sent delegations to study SVH as they design their own national telehealth systems. Indeed, Bahrain this week soft-launched Doctor at Once, a new telehealth service under the Ministry of Health that will connect patients to general practitioners by video within minutes for non-emergency needs, indicating the SVH model's influence in the region. Another domain of digital health innovation is Health Information Exchange, HIE, and unified medical records. The UAE in particular has been advancing on this front. In Abu Dhabi, officials reported that the Malafi HIE platform, which connects public and private healthcare providers in the Emirate, achieved near-complete participation by hospitals this week. This means clinicians at almost any Abu Dhabi facility can instantly retrieve a patient's medical history, lab results, medications, past visits, from any other facility, drastically improving care continuity and safety. While the build-up to this milestone was gradual over years, its realization is a major digital health win. Dubai is not far behind with its NABID Health Information Network. The UAE's Ministry of Health is also working on linking these Emirate systems into a nationwide EHR. The integration of electronic health records exemplifies how digital innovation is knitting together fragmented healthcare systems for better outcomes. AI-driven preventive care got a boost as well. In Oman, the Ministry of Health in collaboration with a local tech startup deployed an AI-powered risk prediction tool in primary care clinics. Debuted this week, the system analyzes patient data, age, weight, lab results, etc., to flag individuals at high risk of conditions like diabetes or cardiovascular disease, prompting clinicians to intervene early. Oman's pilot in Muscat showed promising results. Dozens of patients with elevated risk scores were identified and enrolled in intensive lifestyle programs before they became full-blown diabetics or hypertensive. Given Oman's rising chronic disease rates, such predictive analytics offer a way to focus preventive efforts where they are needed most. The tool is expected to roll out to more clinics nationwide in coming months. Across these examples, one can see the Middle East's strong embrace of digital solutions to amplify healthcare capacity. Governments and health systems are investing in telehealth, big data, AI, and automation not as gimmicks but as integral components of healthcare reform. This week's developments, from Egypt's digitization deals and Saudi's virtual care expansion to Oman's AI risk scoring, all point toward a future where technology-enabled care is standard in the region. Challenges do remain, such as ensuring cybersecurity and data privacy, topics which were discussed at GITEX's healthcare sessions, and bridging the digital divide for remote or disadvantaged populations. Yet, the trajectory is clear. Digital health innovation is transforming Middle Eastern healthcare at a rapid pace, making it more interconnected, efficient, and accessible. Finally, we'll examine population health management efforts, where countries are looking at health at the population level and focusing on prevention, data, and primary care. Middle Eastern health authorities are increasingly embracing population health management strategies, collecting and using data to guide interventions, targeting specific groups for preventive care, and strengthening community health services. This week brought several examples of how countries are taking a more proactive, population-wide approach to healthcare. One notable initiative comes from the United Arab Emirates, which has been integrating health services into the school system to manage the health of the student population. As the new academic year got into full swing, Emirates Health Services, EHS, rolled out enhanced school health programs across 312 government schools it oversees. This week EHS reported on its expanded student screening program, which now includes new tests for early detection of age-specific issues, for example, advanced vision and hearing screenings for certain grades, and mental health questionnaires for adolescents. Trained medical and nursing staff are present year-round at 333 school clinics nationwide, providing first aid, managing chronic conditions like asthma or diabetes in students, and ensuring vaccinations are up to date. Last school year, over 95,000 students received immunizations through these clinics under the National Immunization Program. This year, to boost coverage further, EHS is conducting awareness campaigns with parents about the importance of timely shots, balanced nutrition, and personal hygiene for their children. They even issued a back-to-school health guide to families with tips on healthy lunches, sleep routines, and managing screen time. By actively monitoring and caring for students, the UAE is effectively treating schools as a platform for population health, catching problems early, like vision issues that could hinder learning, and instilling healthy habits that can last a lifetime. The collaborative approach was stressed by EHS's Public Health Director, Dr. Shamsa Luta, who this week highlighted that parents, educators, and healthcare teams must work hand-in-hand daily to reinforce healthy behaviors in children. This comprehensive school health strategy reflects a wider GCC trend of viewing health through the lens of settings, like schools or workplaces, to reach people more effectively. Another focus area is leveraging data and surveys to understand population health needs. In Kuwait, the Ministry of Health's nationwide health survey, which began in August, continued its awareness campaign to encourage public participation this week. Officials announced that tens of thousands of households have completed the detailed health questionnaire that covers lifestyle, diet, and medical history, valuable data to inform Kuwait's future health policies. The campaign emphasizes that by contributing information confidentially, citizens help shape a roadmap for the health services and policies of tomorrow. The preliminary data, expected in a report in a few months, will identify key risk factors and care gaps in the population, enabling evidence-based planning. Kuwait's approach shows the importance of health informatics and analytics as tools in population health management. Vaccination campaigns across the region often take a population health perspective too. We already discussed Syria's big catch-up immunization drive, which is essentially a population health intervention to raise community immunity levels. Similarly, this week Pakistan, while not an Arab Middle East country, it's in the broader region, began a multi-province polio vaccination sweep targeting millions of children under 5, in coordination with Afghanistan, a transnational effort given the virus's spread doesn't respect borders. This underscores the idea of managing health at a population level sometimes means cross-border cooperation, especially for communicable diseases. Public health surveillance and early warning systems were another theme. In Jordan, the Ministry of Health unveiled a new electronic surveillance dashboard that aggregates data from hospitals and clinics in real time to detect unusual spikes, be it respiratory illnesses, waterborne diseases, etc. During this week, officials simulated a scenario of an emerging outbreak to test the system's responsiveness, and it successfully flagged a cluster of hypothetical cases promptly, triggering an investigation workflow. This kind of digital tool is critical for population health by enabling faster responses to potential outbreaks or health threats, thereby mitigating their impact on the larger population. Meanwhile, Iraq moved to implement a national program focusing on maternal and child health, key components of population health. Following the blueprint of the Women and Children's Health Plan, announced earlier in the fall, the Iraqi Ministry of Health this week launched pilot interventions in 2 provinces, free prenatal screening camps in Babil, and nutrition supplementation for children under 5 in Qatar. These pilots will gather data on outcomes, like reduced low birth weight incidence, improved child growth metrics, that will inform scaling up nationwide. The aim is to reduce Iraq's still high maternal and under 5 mortality rates by systematically ensuring every mother and child gets a package of essential services. This life course approach, from pregnancy through childhood, exemplifies population health management by segmenting the population and addressing specific needs of a high-risk group with targeted programs. Throughout the region, technology and data are increasingly underpinning population health efforts. For instance, the UAE's analytics-driven approach to school health, Kuwait's nationwide survey, Jordan's disease surveillance system, and Oman's use of AI in primary care all highlight that health authorities want to be data-informed and proactive. By segmenting populations, students, mothers, migrants, etc., and tailoring interventions like community education, screenings, and immunizations, they aim to improve health outcomes broadly and reduce inequities. Overall, this week's activities underscore a critical shift in the region toward proactive population health management. There is a growing emphasis on collecting and using health data, surveys, dashboards, to guide interventions, segmenting the population to tailor health programs, and focusing on preventive care at the community level. By intervening early, whether through school health programs, immunization drives, or risk factor reduction campaigns, Middle Eastern health authorities aim to improve outcomes and ease the future burden on hospitals. The challenges remain significant, especially in countries with instability or resource constraints, but the strategies being deployed show a recognition that the health of a population is only as strong as its most vulnerable groups. Managing health at scale is moving to the forefront of the regional agenda, promising more efficient, inclusive, and preventive healthcare in the years ahead. Let's summarize this week's review. This week's health and wellness developments across the Middle East paint a picture of dynamic progress tempered by formidable challenges. On one hand, many countries forged ahead with ambitious reforms, innovations, and collaborative ventures. Health authorities clearly prioritized policy measures to enhance care access and affordability, exemplified by Egypt's Global Diagnostics Partnership and Qatar's sustained medicine price cuts, as well as investing in the future through massive infrastructure builds like Saudi Arabia's new hospitals and Egypt's upcoming heart center. These initiatives reflect a shared regional commitment to strengthening healthcare systems, aligning with broader socio-economic visions, such as Saudi's Vision 2030 and the UAE's national agenda. Equally, the region demonstrated a rising profile in research, biotech, and digital health. UAE scientists pushed the envelope on neurotechnology and genomics. Oman and others introduced AI into primary care, and multiple countries expanded telehealth platforms for more integrated care. Such moves indicate that the Middle East is not just consuming medical advances but increasingly contributing to them, positioning itself as a growing global player in health innovation. At the same time, public health challenges provided a sobering counterpoint to these advancements. Conflict and instability in areas like Gaza, Syria, and Yemen continue to exact a heavy toll on health and healthcare delivery. Yet even here, we saw resilience and proactive efforts: a ceasefire that allowed some relief in Gaza, a nationwide vaccination blitz in Syria to protect millions of children, and community health workers in Iran and elsewhere striving to fill gaps. Environmental and economic strains also made their mark, from Tunisia's pollution protests highlighting the health costs of neglecting the environment, to Lebanon's and Iran's struggles where economic crises are unraveling years of health gains. These issues underscore that health security in the Middle East is deeply intertwined with peace, good governance, and sustainable development. The week's news often echoed the mantra heard at the WHO regional meeting: no health without peace. Addressing these broad determinants remains crucial so that the region's impressive health initiatives are not undermined by instability or inequity. On a positive note, wellness and prevention efforts added a hopeful narrative of communities and systems proactively seeking better health. From Jordan's creative approach to addiction recovery through fitness, to the Gulf's enthusiastic Pink October breast cancer campaigns, to the UAE's integrated school health program safeguarding students, there is clear momentum toward preventive care and healthy living. Populations are being engaged via awareness drives, technology, and grassroots programs. The embrace of mental health discourse, promotion of physical activity, and focus on healthy environments, schools, workplaces, all signal an evolving culture of wellness that complements traditional healthcare. Such efforts are vital in tackling the region's high NCD burdens and in empowering citizens to be partners in managing their health. Notably, regional cooperation and knowledge sharing emerged as key themes throughout the week. Whether it was Gulf states uniting to integrate their health strategies, Egypt and China exchanging expertise, or international support for vaccination in Syria, the value of collaboration was evident. The Middle East's health challenges and opportunities often transcend borders, and so do the solutions. This cooperative spirit bodes well for the future. By learning from each other and working together, countries can accelerate improvements and address gaps more efficiently. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and have a wonderful day in good health.